common one which we use across all the histologies, the most common tracer is being used for PET-CT. In particular, for bladder cancer, there are few 68 FABI. So where does nuclear medicine and PET-CT stands in bladder cancer? So how does to manage this? So there are multiple techniques have been developed to dilute the urine so that the waiting the T stage. The newer one FDG PET MR. So it has downstage. So this is an example of a case where we can see a bladder tumor on the left lateral wall, but since there is a high FDG activity in the lower images, we can see the bilateral pelvic nodes which is showing up the increased FDG uptake which are response to NICT and immunotherapy. The conventional imaging modalities are often less sensitive in assessing the response to chemotherapy, particularly in the metastatic lesions. Due to the difficulties in identifying the viable tumor deposit, it gives us split GFR value which can guide us regarding the surgical management, what will be the post-operative in 1 ml. So this can help the medical oncologist in planning the chemotherapeutic regimen and helps the exact dose selection for the CA patients with carcinoma. So that's it from nuclear medicine. Thank you.
70 years. By virtue of age, automatically GFR will be low. But sometimes what happens, the patient's weight is very low, so creatinine value is falsely low. So what happens if creat value is very falsely low, for example it is 0.4, even in 70-year patient, GFR will come to be 70, 80. But that will be misleading. And if you start full dose cisplatin, that might lead to deterioration in the GFR and performance status of the patients. That is why to our help comes the Department of Nuclear Medicine with DTPA-GFR. I think that is with the easy accessibility to DTPA-GFR, we are now doing DTPA-GFR in most of the patients. Any comments, Dr. Lincoln, on this, because this is a very important problem?
Usually a disease of the older age group. Moreover, most of these patients in our setting, they present in a late stage. So most of them usually have a VUJ involvement. Otherwise, the posterior wall of the bladder involvement and resulting in the hydroureteral nephrosis. Most of these patients they do have. So this is a very important point to note, that we need this DTPA-GFR comes to our rescue in these situations. Thank you.
This DTPA-GFR is like very many GFRS patients because this is just 5-minute study and takes very little amount of the overall radioactivity.
Thank you, Dr. Mani, for this.